Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Danielle Simpson. She is a disease intervention specialist here at MCHD. Danielle, good morning.
Good morning, James. How are you?
I'm never better.
Great.
Now, this isn't so random now. There's a reason why you and I are talking today. Today is World TB Day.
Yes, it is.
So that means nothing to anybody else in the world, but every everything to you because March the 24th is significant, obviously. So tell us why.
March the 24th is celebrated in the TB world because microbiologist Robert Koch was able to finally isolate the tuberculosis bacteria in a microbiology lab. So we honor him on World TB Day, which is March the 24th, and we celebrate that each year.
So how long ago was that? Did you say?
Yeah, he was able to isolate it in 1882, and again, that was on March 24th.
Yeah, 1882. That's so TB has been around for a very long time.
It has. TB was first discovered in 1702.
Yeah, that predates us as the health department, obviously.
It does. It does.
Um, so we're talking about TB, which is tuberculosis. So I guess for the sake of conversation, we'll just keep referring to it as TB. But TB, like we established, it's been around for a long time. Um, but there's a reason why we're talking about it. So it's contagious, right?
Correct. TB is very contagious. It can also be fatal, but good news is that it's curable.
Well, your title is disease intervention specialist. So I'm thinking a large majority of your time you have to go and track people down and inform them that they have TB and they need to get treatment.
Yes, correct. There are times where we get patients directly from the hospital, but there are many times where we have to track patients down to let them know. And the reason for that is TB takes so long to grow in the lab, and it could be weeks after patients are tested, and they may receive one diagnosis, and TB pops up later. So there are times where we have to inform people, in that fashion as well.
Well, we should be concerned about TB, obviously, because it's contagious. Um, so, what are the symptoms? I mean, if people are curious if they have TB, what are they?
Um, The symptoms of TB will usually start with a cough, but not always. Patients can also be asymptomatic as well. But usually in pulmonary tuberculosis, we see a cough, a persistent fever, weight loss, and night sweats.
I was doing a little reading so I could be almost as smart as you are about TB.
You are. You are.
Well, I read a lot. But I did read it's possible to have TB but not have TB. So how is that?
That is correct. And in the TB world, what we call that is latent TB. The difference between active TB and latent TB is active TB can present without symptoms or with symptoms, and it's usually diagnosed with a culture and also with a chest x ray. Latent TB is basically an exposure to an active case of TB. And basically, when a person gets tested for TB and it is positive, how we determine whether it's latent or not, we would determine that through a chest x ray. And that will just show if the person has been exposed. And we also offer preventative therapy treatment for persons who have been exposed to TB as well.
So I know that there's certain mitigating risk factors that make people a little bit more susceptible to TB than others. So,
Yes.
what are those?
Well, anyone can get TB, but the risk factors of TB is first, a possible exposure, and two, individuals who are immunocompromised are at higher risk of active TB.
Um, the building we're sitting in right now, um, from 1953 to 1974, this building was a TB sanatorium.
That is correct, James. We house the active TB patients
Yeah.
here at the Mobile County Health Department.
Yeah. When this place closed in 74, we had the option to purchase it as the health department, and we've owned it since 1975. But just a little side note of history. So
Yes,
this isn't our first rodeo in being in a pandemic. Um, there was actually a TB pandemic also too, right?
correct. In the 60s, and maybe even as early as the 40s, United States dealt with a TB pandemic. Very similar to coronavirus, but there were a lot more patients who suffered and died during that period of time. And that is why directly observed therapy was developed for the community to get treatment. And we can also monitor their treatment to ensure that they are actually taking the medication to protect the public.
So a lot of buildings, even like our building, there were a lot of buildings that were created during that time period to house people, these sanatoriums, um,
Correct.
because it was so contagious. They kind of had to kind of confine everybody or
Hmm.
lock them in, essentially, so they couldn't go out in public and infect other people, right?
This is true. This is true. It sounds bad, but the ultimate goal was to get the patient treated safely and without transmitting the bacteria to other people in the community.
Yeah, it does sound bad when you can be locked up, which leads me to my other question to ask you too. If you have TB and you contact somebody with TB
Hmm.
to try to help them and treat them, and they refuse treatment, uh, we're talking, you could possibly go to jail, right?
That's correct. There's also levels to that as well. We offer incentives for our patients to get them to comply with treatment. If that doesn't work, then we do have to submit documentation to our legal team and to the state of Alabama to let them know that we're having some issues with compliance, and the state of Alabama takes it into their hands and takes it further, and you can go to jail for noncompliance of active TB treatment.
Yeah, because it is so contagious.
It
Um,
is.
Not treated, like we mentioned, it's deadly, but it's treatable. And you guys treat people all the time with TB.
Yes.
Anything else that people need to know about TB?
Yes, there's 5 things that I actually want people to know, and
Mhm.
one would be that anyone can get TB. 2, most of our cases here in Alabama are not from individuals who are foreign born. 3, you can have active TB, and you can also have latent TB. That's 2 different types of TB. Active TB is contagious, latent TB is not. You cannot pass latent TB from person to person. 4, TB is deadly, but it's treatable. And 5, if you do not comply with active TB treatment, there are steps that we have to take to get you to comply, but it can also result in jail time.
Yeah, thank you for wrapping all those points up that we had just talked about. So if someone wants to contact us as far as for treatment or information, um, you guys have your own building here. Our
Yes.
information's on our website, mchd.org. Any other way to contact you?
Yes, there's 2 ways to contact us regarding TB here at the health department. If you think that you have been exposed, my suggestion would be to contact the TB clinic directly, and our phone number is 690-8910. And if you are getting TB testing for administrative purposes, let's say for school or employment, the best point of contact would be central appointments. And that's 690-8910. 8889, I'm sorry. And at central appointments, we'll set you up with an appointment to get TB testing for administrative purposes there. But at the TB clinic, we only test patients that have been exposed to TB and active cases.
Well, Danielle, I know you're very busy. Investigations and all types of diseases. So I thank you for your time, and congratulations on World TB Day. I mean, I don't know. I didn't get you a card or anything. I'm sorry.
It's okay. Thank you, James. It was a pleasure sitting and talking with you.
All right. Well, thanks for being on Wellness Wednesday.
Thank you.